How does the uterine lining affect implantation? Have you ever wondered how the uterine lining influences the chances of pregnancy? The uterine lining, known as the endometrium, is vital for embryo implantation, a crucial step in becoming pregnant. Its condition can significantly impact fertility, especially in cases like endometriosis or during assisted reproductive technologies such as in vitro fertilization. The endometrium is the inner layer of the uterus. Each menstrual cycle, it thickens and prepares to receive a fertilized egg. This preparation is mainly driven by hormonal changes, particularly estrogen and progesterone. During menstruation, the lining is about 2 to 4 millimeters thick. As the cycle progresses, it can grow to approximately 7 to 14 millimeters when implantation is most likely to happen. For successful implantation, the thickness of the endometrium must be just right. A thickness of around 7 to 14 millimeters is generally considered optimal. If the lining is thinner than 7 millimeters, it can lead to lower implantation rates. This happens because a thinner lining may not provide a suitable environment for the embryo to attach and get the nutrients it needs. On the other hand, if the lining is excessively thick, it may also cause challenges, although this is less common. Beyond just thickness, the endometrium must also be receptive. This means it needs to express the right signals and have a good blood supply to support the embryo. The receptive window typically occurs about 6 to 10 days after ovulation. If the lining is not receptive, even a high-quality embryo may struggle to implant. Conditions like endometriosis can complicate this process. Endometriosis occurs when tissue similar to the uterine lining grows outside the uterus. This can lead to inflammation, hormonal imbalances, or scarring, which can negatively affect the uterine environment and reduce the chances of successful implantation. In fertility treatments, especially in vitro fertilization, monitoring and optimizing the uterine lining is crucial. After embryo transfer, progesterone supplementation can help maintain the lining's thickness and receptivity. New therapies, like platelet-rich plasma injections into the uterus, are being researched to improve endometrial thickness and boost implantation rates, particularly for women with thinner linings or those who have experienced repeated implantation failures. For those facing fertility challenges or dealing with endometriosis, understanding the state of the uterine lining can help guide treatment decisions. Regular ultrasound monitoring during fertility treatments can assess endometrial thickness and help determine the best timing for embryo transfer. Personalized approaches may include hormonal therapies or regenerative treatments aimed at optimizing the uterine environment. In summary, the thickness and receptivity of the uterine lining are essential for successful embryo implantation. Conditions like endometriosis can hinder these factors, making targeted medical management important in fertility care. By maintaining an optimal uterine lining, individuals can enhance their chances of implantation and pregnancy, especially in assisted reproductive technologies. Always consult healthcare professionals for personalized advice and treatment options.